Hi guys, welcome back to my channel. Today's video, as most of you know, is going to be about endometriosis and PCOS. They are two things that I deal with and a lot of other women deal with. It's actually like 11% of American women deal with endometriosis. I don't remember the percentage for PCOS, but I think it's more common to have PCOS than endometriosis. Could be wrong, don't quote me. Dobby, Kiki, what are you doing? Even though it affects so many women, there's too many that don't even know that they have it and they just think that all their symptoms are normal. And then there's the women that don't want to talk about it because a lot of the symptoms can be embarrassing, and it's like that doesn't make you feel like a lady or people feel like less of a woman. I'll explain what endometriosis is. I pulled it up because I don't want to get off track. Endometriosis, sometimes called endo, is a common health problem. It gets its name from the word endometrium, the tissue that normally lines the uterus or the womb. Endometriosis happens when tissue similar to the lining of the uterus grows outside of your uterus and on other areas in your body where it doesn't belong. Most often it's found on the ovaries, fallopian tubes, tissues that hold the uterus in place, and the outer surface of the uterus. But it can grow in other places too, and that's something that a lot of people don't know. It can grow on the cervix, the vulva, your bowel, bladder, rectum. In rare cases, it can appear in other parts of your body, such as the lungs, brain, and even your skin. So I'll read off normal symptoms and I'll explain what I have, because the more women I've talked to, the more I've realized that a lot of people deal with it differently and are affected differently by different symptoms. And some are a lot worse than others. Like the main symptom of endometriosis is the pain. That's the one that most people can all agree with is usually the worst. It's very painful menstrual cramps. They can get worse over time throughout the day. Chronic long-term pain in the lower back and your pelvis. Pain during or after sex. This is usually described as a deep pain and is different from pain felt at the entrance of the hoo-ha when penetration begins. Intestinal pain, and then painful bowel movements or pain when, going pee sometimes during your menstrual period. Bleeding or spotting between menstrual periods. This can be caused by something other than endometriosis, so you should clarify with your doctor. Infertility, or not being able to get pregnant, and stomach and digestive problems, including like diarrhea, constipation, bloating, or nausea, especially during your cycle. For me, the symptoms that I experience the most with endometriosis is the pain. The pain can be debilitating. Some days it'll just be a dull pain and it's like, all right, this sucks, like this is uncomfortable, but I could usually take a leave and it can kind of help. Other times the pain will be so bad it'll take me down to my knees. It'll put me in bed for a whole day, sometimes multiple days, or until my cycle is done. Pain with sex is really common, and I've had one surgery for endometriosis and I'm due for another soon, but after the surgery that all went away. It didn't last for very long because it comes back. Mine is like sensitive during intercourse. It's more so painful afterwards. The bleeding or spotting, I think this mostly, I'm gonna get to PCOS, but this is, having both of them sucks because the bleeding or spotting between, yeah, it happens, but also with PCOS, it makes your cycle irregular. So some month I'd be bleeding for an entire month. Other months I would go like 2 to 4 months without a cycle. So the infertility is, the pain affects me the most, but mentally the infertility gets me because I've always wanted kids. Danny wanted kids. I have personally had 6 miscarriages, and PCOS and endometriosis work hand in hand in that. The PCOS makes it hard to get pregnant, so does endometriosis, but also more doctors have told me that if you have PCOS, it is really common to have miscarriages. Danny and I actually, at the beginning of this month, were pregnant with twins, and it ended up being ectopic, and I had to have a medical abortion, which had plenty of miscarriages, and they induced a miscarriage with medication, and I gotta say they lied. They said that it would like be about the same, so I was expecting what a normal miscarriage feels like, and I gotta say the pill abortion was the most painful thing I think I've ever gone through. Yeah, but that medical abortion for the ectopic pregnancy, which is many, I don't know if all of you know, but ectopic, you can die from that pregnancy. It's when the egg settles in your fallopian tubes and not on the lining of your uterus. So after that, Danny and I kind of just agreed to not really worry about kids. We're gonna freeze some eggs and hope for maybe the future, and we're not gonna put me through that anymore, because that's mentally draining and physically it sucks. It's painful. The digestive problems, the bloat, the endo bloat, the endo bloat is a bit ridiculous. One day I'll be wearing size 3, my normal pants, 3, 4, it's my normal pant size. I'll wake up the next day and have to be wearing like size 8 or 10 because the endo bloat is so bad. I have had people ask me if I'm pregnant, and they're like, oh my gosh, are you due soon? And I'm just like, no. Then I try to say like, no, I'm just bloated, and they're like, oh. But those are the things that I deal with the most. There's a lot of other things that go into it. I'll start talking about PCOS really fast. I'll say what that is because not everybody knows what PCOS is. It's called polycystic ovary syndrome. It's common in women too. It's an imbalance of reproductive hormones, and you produce cysts on your ovaries, and poly means more than one, so like multiple. The hormone imbalance creates problems in the ovaries. The ovaries make the egg that is released each month as part of a healthy menstrual cycle. Well, you don't have a healthy cycle with PCOS. The egg may not develop as it should, or it may not be released during ovulation when it should be. PCOS causes like missed, irregular menstrual cycles. It can lead to infertility. One of the most common causes of infertility in women is PCOS. Then you develop the cyst, which, if you don't know what that is, I don't know what to do. But you develop those in the ovaries, and the most common symptoms with PCOS is the irregular menstrual cycle. Some women even stop having cycles. I wasn't as lucky. Too much hair. This is a big one. I know a lot of people deal with that, and they never want to talk about it because it's embarrassing. It's like, it makes you not feel ladylike. I will say how I dealt with that in a moment. But too much hair, you get it in places that a man gets it. You get it on your face, your chin, your neck, your belly, just places you don't want it. Acne, thinning hair, weight gain and difficulty losing it, darkening of skin, skin tags. That's what it says. I've not dealt with skin tags. I've not dealt with darkening of the skin. Weight gain and difficulty losing weight is something that I deal with. I have to be so strict, and it's so disheartening because it's like, you gain weight. It's easy. Like the holidays, I always gain weight. I put on like 20 pounds since October. You can't really see it. No one really notices it, but I did. And it's disheartening because you'll eat the same way as these fitness models. You'll work out like 4 hours a day, and it gets you nowhere. You're maintaining it, but you're not losing it. The only way I've been able to accomplish it is like going on a diet similar to the keto diet. It's the low to no carb, high fat diet, and that's the only way I've managed. But I was also doing 2 days at the gym because it was frustrating. It was, I went from being like, I was not a skinny girl in high school. I had baby fat, but like I was still normal size, and then I like blew up at 20, like 19 and 20, at least in my eyes I did, and it just seemed like I was always swollen, like my skin was tight. It was just really crappy. Thinning of the hair or hair loss on the scalp, male pattern baldness. I personally don't know if I deal with that. I've not met anyone with thicker hair than me. I have to get my hair thinned every year, so my hair's in regs for the Navy. But my hair is super thick. If I've lost it, I don't know. It's just, it is what it is. However, my hair changed up on my body. I've always had blonde body hair growing up, and over time I started noticing that my body hair was turning black and getting thicker, and I was so confused because like when I was younger, like all the way up until I was 18, I could shave, not have to shave again until like 4 days later. Now, if I don't shave anymore, I wax everything, like here down, waxed. It is what it is. But now if I shave, by the end of the day, it's prickly and you can see it under my skin, so lame. And the hair is so thick now that if I shave, I get like ingrown hairs. And my skin is so sensitive that if I get an ingrown hair, it ends up scarring, and then I've got like spots on my legs, which is stupid. I hate that. The acne, I never had acne like that I can remember until this all started. And it was like cystic acne, and I was lucky because you couldn't really see it, but it was like deep under the skin and super painful, and they stayed forever and they wouldn't go away, and they would come on like the week before like my cycle, and they would stay and then take weeks to leave, and then by the time it was gone and I was feeling great, like my cycle was the following week and it would start all over again. I have a strict body regimen to take care of myself. I wax my body, I exfoliate exfoliate. Like I feel a little bit raw after some of my showers, but it's to avoid the ingrown hairs. I have a strict face regimen that I have shared, my like face care, how I keep my skin nice, because the odds are against us ladies with these things. I cut out all dairy. Dairy wrecks me. Candy, no. Bread, starchy vegetables, pretty much everything good in life I try to avoid. Sometimes I just have no self-control. I went through this phase, like when I was hospitalized, I went through this phase where I wanted nothing but Hershey's bars. Like I had 5 or 6 king-size Hershey bars within an hour. My aunt brought me them to last the week, and as soon as they stepped out of the room, I ate all of them. I don't know why. I'm a terrible person. The irregular cycles I can relate to. They used to be irregular. They're pretty regular now. I take estradiol, which is estrogen. I was given it as a patch, and then they gave me the intravaginal pills, which those work best for me. It also helps women that suffer from like dryness down there. Personally, I never got that. It's just my skin is too thick to absorb the patches. So just my body didn't absorb it good enough. So I know that is a symptom for Endo and PCOS. Also, something that people don't talk about that often, like the providers, is what it does to you mentally. Like when you have a hormone imbalance, it throws you off like really bad. You get anxiety, depression. It's just like I was stable, and then I hit like 20 and then I wasn't. I was always sad and I didn't know why, or I'd go through like this manic phase and like everything's amazing, and then all of a sudden it's like dread. It just, the littlest thing would make me think that the world is ending and that there was no reason left for me to live. I still deal with that. I have my own coping mechanisms. Like I go see therapists. Who doesn't? It's like free when you're in the Navy. Common misconceptions. You can still get pregnant. I know a lot of people that have both or just one of the two, and they have had kids. I know some people have to do IVF, which is expensive, but others have been able to do it naturally. If you have a provider like an endocrinologist and you see a gynecologist, they are able to help you tremendously. I take Yaz, which is an estrogen-based birth control, and I take the estradiol. And I am not a fan of birth control. I had really bad experiences with the Implanon and Nexplanon. Those are the implants in your arms. And then I use the Depo-Provera shot, and just really, really, really bad experiences, but I've not experienced anything bad with Yaz. Everybody is different with every birth control, but that's the one that personally works for me. I know people are gonna ask, so I brought up the beginning of the month, Danny and I lost a pregnancy. We were having twins. But the reason I ended up being hospitalized is because when you have a miscarriage or something like that, you are susceptible to endometriosis, which is an infection. So when your body is purging those things, your cervix opens. It happens when you give birth. It happens whenever your cervix opens. And so when it opened, there was a chance for bacteria to get in, and it gave me an infection that affected my body. So I had to be hospitalized, and then there were a couple other things that didn't go that well with the pill abortion, that medically induced abortion. Also, something that goes hand in hand with polycystic ovary is issues with your insulin. I am reactive hypoglycemic and insulin intolerant, so there's the weight gain. A lot of people that have PCOS deal with the obesity, and it's extremely hard to lose the weight once it's there. I'm gonna go ahead and answer some questions to get some direction back, because I'm really bad about rambling and I always forget stuff. So I'm gonna go through some of the questions that you guys sent in. I have my laptop in front of me. Any experience with surgery recovery? Just had surgery on Thursday. My surgery was super easy. They went through my belly button, and then they had another incision on the side, and then I think one other one, I don't remember where. They went in, they removed the endometrial tissue that wasn't supposed to be there, and they also severed a nerve from my uterus to my spine. That way when it does come back, which it is, it's not as painful. So this time around, I'm not so dead. I don't know. The pain gets so bad that it feels like you're dying sometimes, at least it does for me. How were you diagnosed? The only way to be diagnosed with endometriosis most of the time is the surgery. So they do blood tests, they listen to all your symptoms, and then once they have a pretty good idea that you do have it, because they don't want to open you up for no reason, then they go in there to see if the endometriosis is there, that tissue is there, and once they're in there, they remove that tissue. That is how you're diagnosed with endometriosis. With PCOS, it's a lot easier to diagnose because the symptoms are so in your face that it's pretty evident if you have issues with your hormones. And then from there, they just piece it together to see if it is PCOS. Best thing for overnight, it's gotten so bad I cry all night and I can't feel my legs from the cyst. For me, a heating pack, 800 milligrams of ibuprofen. I would not recommend taking narcotics like oxys or anything like that for the pain. I did when I first started, and I don't have an addictive personality, but you do become dependent on it, because it's like, why deal with the pain if you have a quick out and a way for it to go away? I don't like pain medications that make me feel loopy. I don't like losing control. So those are what I do. I take a sleeping pill right before bed. It's like these gummies from wherever the gummies Danny gets. I take a sleep gummy, get my heating pack, and one or two 800 milligrams ibuprofen. That is because the Navy's given me so much ibuprofen that it doesn't really work for me anymore. So I take a high dosage. That is not me recommending anybody else takes that dosage. Symptoms I get with both, I think I've explained those. My big ones: the pain, the miscarriages, the crazy hair, unwanted like acne. Did you find that your diet made a difference? My diet made a huge difference. When I cut out dairy and the sugary bad stuff, I was sad inside, but I felt a lot better. I really did. I felt like I had more energy because the fatigue is real and the memory fuzz is real. But when I was eating right, I felt better. My memory, it makes my memory so bad. Endometriosis does, and PCOS. They don't list that as a symptom, but everybody I talk to experiences it as well, so. Ooh, handling endo and the service. I have it and can get no help from these medical professionals. I had been going to medical for 2 years. Quite often, I was getting a lot of shit from my higher ups for going to medical too often, but I just I didn't know why I felt so bad. I was like, I used to feel fine. All of a sudden, I don't feel good anymore. I'm having all of these issues. Like some of this stuff is embarrassing, and it's like, all right, I don't want to live my life wearing jeans and long sleeve t-shirts, and it's like, I feel like I'm wasting my time working out so much and getting nowhere. There's just no explanation. I don't know why. I feel like I'm doing everything right. My advice, keep going. If you think you have these, get some help. If like your PCM isn't helping you, ask them to refer you to the gynecologist at whatever naval hospital is near you, or whatever branch you're in, the hospitals that you guys go to. PCOS cravings. Yep. I experience PCOS cravings really bad. That is about self-control. How am I able to lose weight? Changing my diet significantly is one huge thing, and then staying consistent with working out. It takes a lot longer than it takes other people, which is shitty. It makes you feel bad about yourself, but just believe in yourself and really commit yourself if that's what you want. How did you know you had a problem? When should someone see a doctor? If you feel like your cycle affects your life to the point to where you're unable to do daily activities, go see your doctor. If your body changes, if it's been normal, whatever your normal is, and all of a sudden everything seems to change, like you didn't used to break out, you're breaking out all the time now, your body hair changes, your mood is unstable, and you have no idea why. You have hair loss, hair in places that you don't want it to be, just go see your doctor. If anything is like not normal and it changes your way of life in a negative way, go see your doctor. Explain endo that shows others that it's not just cramps on your period to suck up. It is different. Everybody gets cramps. They are uncomfortable. The difference is that pain can be so severe that you're crying, you can't stand up, or you're walking and then it takes your knees out from under you, you can't get out of bed, it hurts so bad you're vomiting. That pain is excruciating, it's debilitating, and what tests did they get you to do? I had to do blood test, the intravaginal ultrasound. They sent me for an MRI. What else did they do? They did another thing where it wasn't just an intravaginal ultrasound. They went up through my cervix, and I have no idea what that is called. That was super uncomfortable. Yep, but lots of blood tests, the intravaginal ultrasound, the one that went through my cervix, an MRI, and then the surgery, which is the most sure way to get your diagnosis. Otherwise, they're never really sure if it's there. Did you get the surgery for endo with the scope down your throat or through your belly? The laparoscopic procedure is done through your belly, like your belly button. When you got your diagnosis, were you and Dee upset about possibly not being able to conceive? No, because I've had it way longer than I've known Danny. I've dealt with it for about 4 to 5 years now, and Danny and I have only been together for like 1.5 years. So I told him when we first got together that the possibility of us, because I feel like you should be honest, the possibility of us having a kid was really slim, and he's super understanding, but with the miscarriages, everybody deals with loss differently, and it's sad. A lot of pain and how you deal with it, and what about the pain when being sexual? The pain, I take the ibuprofen, I use the heating pad, cryotherapy has helped me a lot, changing the diet's helped a lot. I noticed the pain is not as bad. And then how do I deal with the pain when being sexual? I'm a super sexual person, so I just suck it up, honestly. That's not the best advice. I don't know how you should deal with it. I don't know, because it's just like, I need to be pleased too, and I don't want this disease or disorder to take that away from me. It's like, I'm a horny person. What's the hardest part about living with it? Personally for me, just because I get self-conscious, is the hair. Just about the consistency changed. It went from being blonde and thin to black and thick and grows back really fast. I think it's embarrassing. Granted, I wax it all now, and that's kind of expensive, and I'm gonna do laser hair removal. And I'd say it used to be the acne, but I've kind of got my niche down. The second biggest thing, I would say the infertility, but that's something that I've accepted. How did you stop feeling poorly about it? I have it, and I feel like I'm failing as a woman. I used to feel that way, but then I was like, well, my sole purpose isn't to bear children. I would like to, but if I can't, like, I'm not a woman just because I can't do babes. Yeah, that's pretty much how I got over not feeling like I'm failing as a woman, because it's like, I'm still the shit, I just can't really make a baby. Do you want to try CBD? Yes, I do, but I'm still active duty military and we're not allowed. But when I get out, I'm trying that. I'm gonna put a couple drops of it in my Black Rifle coffee in the mornings. Me seeing a specialist is what has made it easier for me, because I did the surgery and now there's more focusing on combating the symptoms. So once you get the symptoms under control, it's a lot easier to deal with and manage, for me personally. I think I have covered just about everything. I'm scatterbrained all the time and can't remember everything. So if I've missed anything, you can ask me. If I don't know something, I'll try to help you find an answer. So far, everything I've experienced is that everybody's disease is a bit different. It may be the same diagnosis with the same symptoms, but some are more extreme for others. If you have any questions, comment down below. I'll do my best to help answer. If I don't have the answers, I'll try to find them for you. I love talking about this. I don't think enough people talk about it. That's why I'm doing a video. I'm by no means an expert. It's just when I was diagnosed, there were no answers. I couldn't really find anything. And I feel like the more women talk about it and their experiences and that they need help, the more help that we're gonna get, you know? Like, there's no cure, and then they say that they don't really know what causes it. Well, they can find it, just as if more women talk about having to deal with it instead of just keeping it a secret and pretending that those symptoms aren't there, you know? Well, thanks for watching. Share, spread the word. Maybe we can get some more help and some more answers.